Sensitivity is the ability of a test to detect a disease or condition.
It is determined by the percentage of patients with the condition that test positive for it.
Or in other words, the percentage of cases that are detected.
The higher the percentage of cases that are detected, the higher the sensitivity of the test.
A case that goes undetected is referred to as a false negative.
The more cases that go undetected, the higher the false negative rate and the lower the sensitivity.
And conversely, the higher the sensitivity of the test, then the lower the percentage of patients with the condition that will test negative. A low false negative rate is a characteristic of highly sensitive tests, which makes it useful for screening purposes.
And that makes sense, because you do not want a screening test to incorrectly tell patients that they do not have the condition when in fact they do.
When a test is very sensitive, a negative test result means that the presence of the condition is very unlikely and therefore can be confidently ruled out.
A patient presents with signs and symptoms suggestive of primary syphilis. The doctor orders a rapid plasma reagent test, but it comes back negative. Knowing that the test is very sensitive and has a low false negative rate, the doctor realizes that the patient probably does not have syphilis. Further testing indeed shows that the patient had another condition.
This is an example of the ability of a very sensitive test to rule out a disease based on its very low false negative rate. Another example would be the ability of a negative D-dimer test to rule out a deep venous thrombosis.
While tests with high sensitivity are good at detecting a condition, they may not be good at excluding the condition in people that do not have it. That is, some individuals without the condition may test positive as well.
So although a negative test result would suggest the absence of the condition, a positive test result does not always mean that the condition is present. Therefore, when a screening test comes back positive, the patient should undergo further testing in order to determine whether the test was correctly or falsely positive.
A woman who is 8 weeks pregnant is surprised to discover that her screening rapid plasma reagent test came back positive. Knowing that screening tests are better at ruling out a condition than they are at ruling one in, her doctor decides to order the FTA-ABS test to confirm. When it comes back negative, the doctor considers the possibility that the initial test was a false positive. Further testing indeed shows that the woman did not have syphilis.
This is an example of a false positive that can occur with the plasma reagent test, possibly due to the presence of antiphospholipid antibodies. Other tests that commonly produce false positives include the fecal occult blood test when screening for colon cancer, electrocardiography when looking for left ventricular enlargement, and the ELISA test for detecting Lyme disease.
Now let's move on to the equation.
Sensitivity is calculated by dividing the number of true positives by the total number of people with the condition.
To help us understand this equation, we are going to imagine that a group of people are being tested for a disease.
The red squares represent people who have the disease, and the white squares represent people who do not.
Since sensitivity only takes into consideration people that have the disease, we are going to focus on the red squares.
This yellow line represents a cutoff level for a test.
To the left of the line, the test returns negative, and to the right, it returns positive.
Now, let's shift our focus to the sample table in the top right corner. When calculating the sensitivity, we only need to use the column on the left. This column is used for people who have the condition. In the top box, we have the true positives. In the middle box, the false negatives. And on the bottom, the total number of people with the condition.
Counting the squares, we find that there are 26 true positives, 7 false negatives, and 33 people in total with the condition.
All that's left to do is enter the data into the equation. In doing so, we find that the sensitivity is 26 over 33, which is 79%.
Shifting the cutoff level for a positive test towards the left, that is, closer towards the normal value, increases the number of true positives, which means that the condition would be detected in a greater percentage of patients that have it, and thus the sensitivity of the test would be higher.
And on the other hand, shifting the cutoff level for a positive test away from the normal value would increase the number of false negatives. Thus, the sensitivity of the test would be lower.
To recap, sensitivity is the ability of a test to detect a disease or condition, and it is calculated by dividing the number of true positives by the total number of people with the condition.